Turn to a piece of good news because the World Health Organization has hailed the rollout of a new malaria vaccine as life-saving. The vaccine, called RTS S, is the result of 30 years research and development into the mosquito-borne disease. It's being given to children in parts of Cameroon, which are worst affected by malaria, after trials in Kenya, Ghana and Malawi. Well, Cameroon currently records about 6 million malaria cases every year and 4,000 deaths, and most of those are children under 5. It's hoped that other countries could soon get the vaccine as well, including India, parts of southern Europe and also Latin America. Well, let's talk now to our senior Africa correspondent, Anne Soy. And Anne, I was talking about good news because this is a really, really significant moment, isn't it?
It is a significant moment in history. You're talking about that 30 years that scientists have been looking for this vaccine. And just to appreciate how difficult their work has been, most of the other vaccines that we have are against viruses. This is against a very complicated parasite. So indeed, it was a breakthrough when they finally found a working vaccine. And the fact that it is being rolled out today is historic. And the hope is that it will save many, many lives here in Africa, and especially the lives of children under the age of 5, who are, the target group with this vaccination.
Tell me logistically how they're approaching this, and when do they hope that it could be rolled out in those other countries I was talking about there?
So the rollout has started today and will continue over the next 2 years. Already there's a huge demand for this vaccine. More than 28 countries have expressed interest in rolling it out in their countries. Not every country will have it right away. The Vaccine Alliance, Gavi, says that it has secured about 18 million doses, which is there's still a huge shortfall. However, there's a second vaccine that was recommended for use by the World Health Organization at the end of last year. It is still going through regulatory approvals, and once that is over, it will also be added onto the list of the growing list of vaccines against malaria. So indeed, that will help fill in the gaps, and it will be manufactured by the Serum Institute of India, which has said that it will be able to mass produce hundreds of millions of doses per year.
And that was absolutely crucial when they made that announcement a few months ago, that hookup in terms of supplies of the drug, and you were talking about that. What about the cost of this, as well as supplies of the drug?
Well, the cost is being met, as with many of the other childhood vaccines, through fundraising by the Vaccine Alliance and other organizations. And therefore, the countries that are benefiting from this, many of which are poor, will not really feel the cost of buying this vaccine. But the Serum Institute for R21, the second vaccine, is confident that it is able to produce it, to mass produce it at a minimal cost. And so, it is being rolled out from now across, starting from Cameroon, and they are prioritizing countries where there's the greatest need for the vaccine.
Anne Soy, thanks for the latest on that story. Thank you.